Hi, everyone, and welcome. I'm Steve Buick, the Press Secretary to Health Minister Tyler Shandro. We're going to be here till about 12:30 with questions on the line as usual. We have two speakers, the Minister and then Christine Nielsen, who will introduce herself. She's with CSMLS. We have a couple of resource people here for technical questions, but we'll call them only if needed. So with that, Minister, if you're ready to go, I'll ask you to begin.
Thank you. And good afternoon, and thank you for joining us. As this pandemic has clearly demonstrated, effective laboratory services play a critical role in protecting public health. That's why our government has committed to investing in lab equipment and capacity to improve its services in Edmonton and Northern Alberta. And today, I'm pleased to announce another step forward for laboratory services in Northern Alberta. We're providing $15 million in new money to equip laboratories in Edmonton and across Northern Alberta with new and upgraded lab equipment. This funding will further strengthen our province's health system and ensure people have access to top-quality health services, including the laboratory and diagnostic services that they need. Over the next number of months, Alberta Health Services will be installing new microscopes, tissue processors, analyzers, and centrifuges in many of their facilities so that patients have access to the latest technologies for blood or tissue, liver or kidney analyses, among many other uses. Modern technology and equipment is key to helping medical laboratory technologists, other medical staff and physicians diagnose and treat Albertans. Every year, about 2.3 million Albertans get 75 million lab tests done every year. Lab tests and results inform more than 70% of their healthcare decisions. The importance of this work has been especially highlighted during our response to the COVID-19 pandemic. Here in Alberta, our labs have performed as well as any in the world, making us a leader in testing per capita and a leader in innovation. They've made it possible for any Albertan to be tested for COVID-19, whether or not they have any symptoms. Our success as a province in limiting the spread is in no small part to the outstanding work of our labs and our laboratory technologists. This $15 million infusion into lab equipment will ensure laboratories in Edmonton and Northern Alberta continue to provide top quality tests as we continue to fight the virus. Not only will our large hospitals in Edmonton benefit from this investment, but also facilities in Northern Alberta, from Leduc to Boyle, from Bonneville to Grand Prairie, and beyond. We know that there is a need in these areas, and we are meeting those needs. This is over and above our annual $30 million commitment to replace and upgrade medical equipment around the province. We know all Albertans, no matter where they live, deserve the best public health care that is available to us. This investment in AHS Laboratories will ensure people in the Edmonton area and in Northern Alberta, communities in Northern Alberta, get the support that they need for their health and treatment journey now and for the years to come. So thank you for joining us. I would now like to invite Christine Nielsen, the CEO for the Canadian Society for Medical Laboratory Science, or the CSMLS, to come and give remarks, and thank you to her for joining us today. Christine?
Thank you so much. As the CEO for the Canadian Society for Medical Laboratory Science, I'd like to recognize today's significant announcement and thank the Minister for his ongoing commitment to modernize lab equipment in Alberta, as well as to ensure that our facilities are meeting the current and future needs of Albertans. Today's announcement of $15 million for new lab equipment for the Edmonton and Northern Alberta regions will make a big difference in the state of lab infrastructure in the province. It follows our ongoing dialogue with the Minister and the Government of Alberta, which outlined the needs of our members as it relates to lab infrastructure. CSMLS represents over 3,000 medical laboratory professionals across the province who conduct 75 million lab tests in Alberta each year in a safe, reliable, and timely manner. We conduct a broad range of tests to support diagnosis and treatment of patients, and this testing allows other medical professionals to make important and informed decisions with their patients. We know our members have stepped up during COVID-19 with the additional testing needs and will continue to ensure patients and the public have these essential services available to them. We're also pleased to note that the new grant funding will go towards both major urban centres and smaller communities, offering the same level of lab service regardless of where you live in the province. It's important, and today's announcement will help support these efforts. Thank you.
Thanks. So with that, we'll take questions, please. I think we have people on the line. So go ahead. First question.
Our first question comes from Tyson Fedor of CTV News. Your line is open.
Hi, this is for the Minister. Mr. Shandro, with the Flames and the Oilers both set to be in the NHL bubble very soon in the coming days, who is administering their COVID-19 tests as we speak? We know that they'll be privately done once the NHL puts teams into the bubble, but are AHS doctors and nurses doing this, or is it being done privately? And if AHS is doing so, some feel it's creating a backlog, so why is that the case?
Well, there will not be a backlog. The tests are being provided by Dynalife. And for those who aren't in Northern Alberta, Dynalife is our community partner doing the community lab tests throughout Northern Alberta and Edmonton. If you can imagine, the 70% of community lab work that's already being done, Dynalife provides that service in Edmonton and Northern Alberta. They will be providing those tests for the NHL teams.
Thanks. A follow-up? Yeah, so as we speak right now, who's actually doing it for, say, the Flames and the Oilers? Are AHS nurses doing it, or is it once the bubble commences, that's when Dynalife will be doing that?
Well, unless more, I don't know, more if you want to come up to provide more clarity. My understanding is that it's Dynalife. So Dynalife is our independent provider in the system. My understanding would be Dynalife employees who'd be providing those tests. If I'm wrong, or if you want to supplement my answers, Mauro, and maybe just. Mauro, your last name is pronounced Keyes, though, even though it's Keyes. Sorry. This is Mauro Keyes, who is a director at AHS. The laboratory system in AHS, including Alberta Precision Labs, falls under his portfolio. So, Mauro, if you want to come up and provide some supplementary answers.
Sure. Just to add to it, the Flames and the Oilers have approached both AHS, APL Lab, and Dynalife, and Dynalife has agreed to take on the contracted testing for that. So in the earlier question, is there any potential backlog? There's not, because Dynalife is doing the testing separately for those, and APL will continue to do the COVID testing for the general public.
Good. Thanks, Mauro. Next question.
Next question comes from Carrie Tate of the Globe and Mail. Your line is open.
Hi, thank you. I'm wondering, right now there's a backlog of tests in Calgary. People who are asymptomatic cannot book a test. At one point, there was a goal to get to 20,000 tests per day in the province. I'm wondering what the plan is to clear the backlog and when you expect people who are asymptomatic to be able to access tests, particularly when we're now bringing on the hockey team.
Sure. Mauro, do you mind coming back up to the podium and answering that question?
Great. Thank you, Minister. So right now, we're seeing a larger influx of individuals with who are asymptomatic coming forward to the centres. So that the backlog is not the testing at this point in time. We still haven't reached our maximum capacity. That's not the backlog. Where we're having a bit of a struggle right now is finding staff to assist in the assessment centres to be able to book all the patients that are calling in and get those appointments booked. What we have done right now, AHS has done a call out to all of our provincial programs and all of our acute care centres to look for other individuals that we can second. And so what we're looking for is trying to ramp that up significantly, particularly in areas that are seeing the highest pressure points. And we're looking to allocate staff to those areas so that we can get those people through more quickly.
Thanks, Carrie. Did you have a follow-up, or do we move on?
When do you expect that to clear?
We've put the call out over the past 48 hours over the weekend, and we are already starting to see the staff redeployed. So we're hoping that if all goes well, that hopefully by later in the week we'll be able to clear some of that backlog. Right now we're very busy, obviously, with COVID itself and the treatment of the patients, but we're hoping that as we get staff redeployed as quickly as possible, that later in the week we'll start to alleviate some of those pressures.
Thanks, Mauro. Next question.
Our next question comes from Lisa Johnson of Post Media. Your line is open.
Hi, thanks for taking my question. I'm wondering why this announcement is coming now. Has this been at the top of the wish list for the HSAA? Or why do labs need this equipment right now? What's the timeliness of it?
Well, as I said in my remarks earlier, this is our continued response to COVID-19, as well as our continued commitment to investing in our public lab system here in northern Alberta and throughout the province. And so as we see needs, we're going to be addressing them and making these announcements as they come up. Follow up? No?
Follow up, Lisa?
No, sorry. Well, since I have the minister on the line, I'm wondering if you have seen the news this morning that a member of the Health Quality Council of Alberta has decided to resign because of criticism he has of Bill 30. He basically says that it makes the council subject to the whims of government, and I'm wondering if you can comment on that.
Well, it certainly doesn't make the HQCA subject to the whims of government. Look, many of our agencies have a close relationship. We are aligning ourselves with the models with other provinces have with their quality councils, and we think that's really important for us to make sure that the HQCA here in Alberta is aligned with government and the ministry's commitments and objectives. And I think making ourselves aligned with these other provinces give us the opportunity to work better with the HQCA, as well as the other changes we made to their legislation, expanding their focus to including person-centered care. And I'm really looking forward to the opportunity of working with the HQCA, same as many other jurisdictions do with their health quality councils, to be able to do that work. And so I think this is a great opportunity for us, and I'm looking forward to it.
Thanks, Lisa. Next.
Our next question comes from Andrea Hunkar of CBC. Your line is open.
Hi there. I just wanted to ask about outdated equipment in labs. What is the current estimate of the dollar value of equipment that needs replacement?
Well, if we can follow up with you about that afterwards, we'd have to get back to you. I apologize.
No problem. I know I think it was in a 3-year-old report, but I'm just looking for an updated number. Thank you.
Thank you.
Yeah, we can ask AHS to follow up through their lab system for that. Andrew, we'll get AHS to get back to you. Thanks.
Thanks.
So next question.
There are no other questions on the phone at this time.
Oh, I guess that's it. So we'll wrap up early. Thanks, everyone on the line. Thanks, Minister. Thanks, Mauro. Other guests. Christine.
Thank you, Christine. Thank you, Mauro.
And we'll get AHS to respond to Andrea. And if there's anything else, as always, you can contact me anytime. Thank you.
Thank you, everyone.